Hello, everybody, and welcome to 3 o'clock with SOC. Happy Friday. Give me just a second so I can make sure that people that need Spanish interpretation can have access to it. Buenas tardes, muchísimas gracias por estar aquí con nosotros en otro foro comunitario con SOC. Feliz viernes. Como siempre, ustedes pueden escuchar el programa en español a través de una llamada de conferencia. Y el número que hay que marcar aparece aquí en la pantalla y es 646-749-3122. Y luego hay que poner la contraseña que es 779-328-221. Thank you so much. And again, if you need those numbers, they will be in the comment section. And I also just want to remind everybody that if you can't be with us at 3 o'clock live, you can always have access to these videos and interviews with guests on our Facebook page or on our YouTube page. They will remain on the page after we stream them live. So whenever you want, feel free to review those videos, watch them again, share them with friends, and always comment and engage with it whenever you want to. I'm Gabe Charles. I'm the Civic Engagement Manager, and I just want to remind you all that you can continue being in touch with SOC even though we are still all working virtually and aren't doing any work in person. You can call our office at 414-672-8090. You can email us at any time at soc@socmilwaukee.org, or you can just check out our website at socmilwaukee.org. There's always updated information on there for everybody, and we incorporate the new things that we learn through these forums and from our guests into the website as well. We also have a SOC survey that is ongoing, so if you have any feedback for us, if you just want to tell us we did a good job, if you have an idea for a topic you want us to discuss, go ahead and fill out that survey. We love getting that feedback from all of you, and it's always nice to be able to see that we have people watching and care about the program. I also want to remind you all that I am not wearing a mask, and that's because I am working from home virtually, but if we were working in the office, I would absolutely have my mask on to ensure my safety and the safety of others as this pandemic rages on. And I also just want to see who's here with us today, so if you're watching, even if it's not live, go ahead and give us a like, give us a comment, say hello in the comments. We always love to see who's watching, and we won't put you on the spot or anything. So go ahead and give us a like, a little heart, whatever it may be, to show us that you're here watching with us. I also just want to share a disclaimer that the views and opinions shared today do not necessarily reflect those of SOC. There are certain topics that we can dive into as SOC, but we will always give the voice and opinion to those guests that we bring on. So always got to give that disclaimer. And today is Organizing, Leadership, and Community Day. We're going to be talking with City of Milwaukee Treasurer Spencer Coggs. And then we also have a great week coming up next week. So we have on Monday, I'll be here with Carlene from Wisconsin Voices, who's going to be talking about redistricting and gerrymandering, which is a big topic right now, especially after the census. We go through a process of redistricting. So that's going to be really interesting for everybody. Then Tuesday, we're going to have Maggie Kellogg coming on from the Peak Initiative. And on Wednesday, we're going to have Alderwoman Jocasta Samaripa on with us on Inauguration Day. So we'll be able to talk a little bit about that and what the future will look like. Then Thursday, we're going to have Claire Evers on with us from the Milwaukee Public Health Department. And finally, on Friday, we are going to be having someone from the operations division of the Department of Public Works come up. So we've got a packed week for you all next week as well. So you definitely want to be on with us. As of right now, I don't think that our guest has arrived, but I do just want to go ahead and say hi to folks that have said hi. Jasmine's there. Hello, Jasmine. Hey, Ariana, Isaiah, Lucas. Thank you all for being on and for saying hello. We love hearing from you. And again, our guest has not arrived, so we can just go ahead and go into the COVID update that Marlene prepared for us. If it's on there.
Hello, everyone. My name is Marlene Zaran, and I am the Public Health Coordinator here at the Southside Organizing Center. Today I'm going to be going over some COVID-19 updates for you guys. So the first update I have for you guys, we have a lot of updates today. We just have a lot. So just kind of like a summary of the weekly updates that have happened throughout the week. So Governor Evers and the Department of Health Services called for the federal government to increase Wisconsin's weekly COVID-19 vaccine allocation. The next update is that Governor Evers announced the Wisconsin National Guard and the Department of Health Services will be launching the Mobile Vaccination Teams pilot program to help vaccinate and help reach all corners of the state. And then another update is that they both have also announced $86 million in funding for local and tribal health departments to further support COVID-19 response and the vaccine administration. Another update I have for you guys is that the lab partners identified the variant B117, which is another strain of COVID-19 in Wisconsin. This strain actually was found in England, but now they just recently found it in Wisconsin. The discovery of this strain, which researchers believe to be more infectious than any other of the strains of COVID-19, which makes taking preventative measures even more important, such as socially distancing and wearing a mask everywhere you go and washing your hands and sanitizing. Wisconsin also will begin vaccinating in assisted living facilities through the Federal Pharmacy Partnership for Long-Term Care Program starting Monday, January 25th. So not only did the firefighters and police department individuals now being vaccinated as part of the phase 1B, we also have those that are in assisted living facilities being vaccinated now as well, starting January 25th. Another update I have for you guys is that the DHS, or the Department of Health Services, expanded the vaccine data webpage to include vaccine administration per day by county and region in Wisconsin, as well as a graph showing the second doses that were being provided. So yeah, that is the update that I have for you guys. One thing that I think is important as well is going over the current COVID-19 numbers. So let me just pull up my screen here and show you guys the current COVID-19 numbers in, oops, 1 second. All right, here we go. Okay, so if you can see here on my screen, I'm gonna zoom in because last time I was sharing this, it wasn't that clear. So here I'm gonna zoom in. So hopefully you can see that clearly. As you can see here, the current cases within, let me put it for 7 days. So the last 7 days for the 53215 zip code, we've actually had an increase of 174 cases. Last week, within that 7-day period, it was 90 cases that were reported positive. And then when we look at the 53221 zip code, we have 84 cases. So now the 53221 zip code is actually increasing in the number of cases as prior, when you compare it prior to the holiday. Another zip code that we usually go over is the 53204, which has 84 cases of 84 positive cases. So yeah, you can see here that these two zip codes are nearing the more yellow and red zone, which is an increased number of cases. And the more green each zip code gets, the less number of COVID-19 cases is apparent. So that being said, the current number of cases in Milwaukee, so the total cases right now is 423 cases in the white population. And then the second most affected community is the Black or African American community with 332 cases. And then 241 cases for the Hispanic or Latino OAX community. And 8.5% of cases go to the Asian community, which is 109 cases. 95 were reported unknown, and 76 were reported other. As you can see in the chart, that the 25 to 34-year-olds have the highest number of cases currently in Milwaukee, with 15 to 24-year-olds coming in second, and 35 to 44-year-olds coming in third. And then if we look at deaths, we'll see that the number of deaths by race and age group, we see that those that are 65 years and older, who are from the white community, have had 160 deaths. And the Black community, those that are 65 and up, have had 155 deaths. Those that are Hispanic or Latino OAX, that are 65-year-olds and up, there have been 50 deaths. And those that stated that they were Asian or Pacific Islander, there have been 16 deaths of those individuals that are 65 years and up. Those that range from the 50 to 65-year-olds, there has been 45 deaths from the Black community. At the Black community coming in the highest. The second coming in is the Hispanic community or Latino AX community, coming in second with 32 deaths. And the white community for 50 to 65-year-olds coming in third with 16 deaths. And those that are Asian or Pacific Islander, 50 to 65-year-olds, there have been 6 deaths. Those that are 50 and under from the Black community has the highest rates with 15 deaths, and then the Hispanic or Latino AX community with 12 deaths. As you can see here, the Black and Hispanic community, Hispanic or Latino AX community that is 50 years and under has had the most impact as compared to when you compare it to the other age groups. 50 and under, it does say a lot, because those communities are underserved communities and they do have health inequities, and they are the communities in Milwaukee that have the most health concerns or chronic diseases. So, if you are under 50 years old and you're from the Black or African American community or Hispanic, Latino AX community, just remember to socially distance and be mindful of who you hang out with, and wear your mask everywhere you go. That is my COVID-19 update for you guys for today. I hope you have a great rest of your weekend. Thank you.
Thank you to Marlene, as always, for keeping us up to date on what's going on with the vaccine and COVID in general. We had a question in the comments asking about when the vaccines will start for the community or for the general public. And that is undetermined. Basically, the general community or general public would be in phase 3, and we're still in phase 1B. So after more healthcare workers are vaccinated and the nursing homes are vaccinated, they'll have a better idea of when it will be available for the general public, just so everyone knows. But again, thank you, Marlene, for keeping us up to date with that. And now I would like to welcome on our guest for today, City of Milwaukee Treasurer Spencer Coggs. Thank you so much for being with us.
My pleasure. Can you hear me okay?
We can.
Oh, good.
So thanks again for being on with us. We hope you're doing well this Friday. Why don't you just start out by giving us a little bit about yourself and what the role of the City of Milwaukee Treasurer is?
Sure. I've been the elected city treasurer since 2012, and I've won 2 elections since. Basically, the job of the city treasurer is to collect taxes, property taxes, and we do a very good job. We collect 98% of every dollar that is levied, okay, in our city. And it's important to know that we do a very good job. And the other thing that is really important to know is that people in the city of Milwaukee, for the most part, enjoy paying their taxes. Now, that sounds weird, I understand, but when we sent out the bills in December, we always have people who say, how come you haven't sent me my bill yet? How come you haven't sent me my bill yet? We have people who ask in November about their property tax bill in December. So people want to be responsible. People want to be accountable. And we enjoy that relationship with people, that people are